Welcome to Study Neuro. In this video, we'll cover part 1 of our series, 20 Must-Know Brain Tumour Questions. These 10 questions highlight key facts, diagnostic clues, and imaging features every medical student and resident should know. Each answer comes with a short, clear explanation to help you recall and apply these concepts confidently. Let's begin with question 1. Question 1. Which of the following syndromes is associated with multiple central nervous system tumors? A. Down syndrome. B. Li-Fraumeni syndrome. C. Marfan syndrome. D. Klinefelter syndrome. The correct answer is Li-Fraumeni syndrome. This hereditary cancer syndrome is caused by a mutation in the TP53 gene, which plays a crucial role in tumor suppression. Patients with Li-Fraumeni are at increased risk of developing gliomas, Medulloblastomas, and several systemic cancers, including sarcomas, breast carcinoma, and leukemia. Always remember, genetic cancer syndromes like Li-Fraumeni highlight the importance of molecular genetics in neuro-oncology. Question 2. What is the most common malignant brain tumor in children? A. Pilocytic astrocytoma. B. Ependymoma. C. Medulloblastoma. D. Craniopharyngioma. The correct answer is Medulloblastoma. This is a malignant embryonal tumor that typically arises in the posterior fossa, most often from the cerebellar vermis near the fourth ventricle. Because of its location, it can block cerebrospinal fluid flow, leading to hydrocephalus, headache, vomiting, and gait disturbance. Medulloblastoma is highly cellular and tends to spread through CSF pathways, forming drop metastases along the spinal cord. Thankfully, it is radiosensitive, and with combined surgery, radiotherapy, and chemotherapy, many children achieve long-term survival. Question 3. Which brain tumor often arises from the arachnoid cap cells? A. Schwannoma. B. Meningioma. C. Oligodendroglioma. D. Astrocytoma. The correct answer is Meningioma. Meningiomas originate from arachnoid cap cells, also known as meningioepithelial cells, which are located in the arachnoid layer of the meninges. They are slow-growing extraaxial tumors and are usually benign. Although most are intracranial, they can also occur intraorbitally or along the spinal canal, essentially anywhere arachnoid cells are found. On MRI, meningiomas typically show intense enhancement with a characteristic dural tail sign, and hyperostosis of adjacent bone is a common finding. While the majority are WHO grade 1, certain histologic variants, such as chordoid and clear cell meningiomas, are classified as grade 2 due to a higher recurrence rate, and rhabdoid meningiomas are often grade 3 because of their aggressive nature. Remember, when you see a dural-based, well-circumscribed lesion with a dural tail, think meningioma. Question 4. Which brain tumor is classically located in the cerebellopontine angle, or CPA? A. Meningioma. B. Vestibular Schwannoma. C. Glioblastoma. D. Pituitary adenoma. The correct answer is vestibular Schwannoma. Vestibular Schwannoma is a benign Schwann cell sheath tumor that typically arises from the inferior division of the vestibular nerve. It is the most common non-malignant nerve sheath tumor, presenting with the classic triad of unilateral sensory neural hearing loss, tinnitus, and imbalance. As the tumor enlarges, it may compress the facial nerve, leading to numbness, weakness, or twitching, and can even cause brainstem symptoms in late stages. On MRI, it shows strong gadolinium enhancement and extends into the internal auditory canal, giving the distinctive ice cream cone appearance. Remember, when you hear about progressive unilateral hearing loss, always think vestibular schwannoma. Question 5. Which brain tumor is associated with chromosome 22 loss? A. Glioblastoma. B. Meningioma. C. Medulloblastoma. D. Schwannoma. The correct answer is Schwannoma. These benign nerve sheath tumors are linked to the loss of the NF2 gene on chromosome 22, which encodes the tumor suppressor protein Merlin, also known as Schwannomin. Loss of Merlin disrupts normal growth control in Schwann cells, promoting tumor formation. In neurofibromatosis type 2, this mutation leads to bilateral vestibular schwannomas, a hallmark diagnostic feature. Remember, chromosome 22 loss and NF2 mutation are classic clues to schwannoma. Question 6. Which intracranial tumor typically shows a dural tail sign on MRI? A. Schwannoma. B. Meningioma. C. Metastasis. D. Glioblastoma. The correct answer is Meningioma. This extraaxial tumor arises from arachnoid cap cells and is usually benign. On MRI, meningiomas show bright, homogeneous enhancement and the characteristic dural tail sign, a thickened, tapering enhancement of the dura extending from the tumor margin. It's caused by vascular congestion and reactive thickening, not always direct tumor infiltration. Also remember, meningiomas may cause hyperostosis of nearby bone and exert a mass effect on the underlying brain. Question 7. A butterfly glioma appearance on MRI suggests A. Oligodendroglioma, B. Glioblastoma multiforme, C. Ependymoma, D. Craniopharyngioma. The correct answer is glioblastoma multiforme. This high-grade astrocytoma is notorious for its rapid growth and infiltrative nature. It often crosses the corpus callosum, producing the classic butterfly appearance on MRI. You'll also see features like ring enhancement, central necrosis, and significant surrounding edema. Always think of a butterfly-shaped lesion across the midline, and you're likely looking at glioblastoma multiforme. Question 8. Neurofibromatosis type 2 is strongly associated with A. Astrocytoma, B. Vestibular schwannoma, C. Meningioma, D. Ependymoma. The correct answer is vestibular schwannoma. NF2 is caused by mutations in the NF2 gene on chromosome 22, which encodes the tumor suppressor protein Merlin. Loss of this protein predisposes patients to bilateral vestibular schwannomas, a classic finding in NF2. Affected individuals often develop multiple meningiomas and ependymomas as well. So remember, when you see bilateral acoustic neuromas, always think of neurofibromatosis type 2. Question 9. Isotret dehydrogenase mutation in gliomas is associated with A. Poor prognosis, B. Better prognosis, C. no prognostic value, or D, exclusive to children? The correct answer is better prognosis. Gliomas with IDH mutations show slower growth, improved treatment response, and longer survival. These mutations are common in lower grade and secondary gliomas and have become an essential biomarker in modern neuro-oncology. So, whenever you see an IDH mutant glioma, think of a favorable outcome and better prognosis. Question 10. Methylguanine methyltransferase, MGMT, promoter methylation predicts A. Resistance to chemotherapy, B. Sensitivity to temozolomide, C. Poor response to radiation, D. Inflammatory response. The correct answer is sensitivity to temozolomide. The methylguanine methyltransferase gene normally repairs DNA damage caused by chemotherapy. But when its promoter is methylated, this repair function is silenced, allowing temozolomide to work more effectively. That's why methylguanine methyltransferase promoter methylation is considered a favorable prognostic marker in glioblastoma. Fantastic work completing part 1 of our 20 must-know brain tumor questions series. Up next, in part 2, we'll dig deeper into more questions. If you want a quick refresher before continuing, watch Brain Tumors Explained in 5 Minutes, Types, Symptoms, and Key Molecular Markers. Link in the description. For a more detailed review, check the full lecture, Overview of Brain Tumors, full lecture, 14 minutes, also linked below. Remember to like, subscribe, and hit the notification bell so you don't miss part 2. Keep learning, keep practicing, and see you in the next Study Neuro session.